Hi, I'm Aisha Brooks. I am the Executive Director for Healthy Community Brookfield, and I am giving a presentation on how we can improve HCB's internal and external structure, community partnerships, and overall accreditation for Public Health Accreditation Board. So, for my presentation, I will be discussing HCB's programs and services, environmental factors that face HCB, as well as a SWOT analysis, current and the potential mission and vision statements for HCB, a 5-year strategic plan, action plan, and concluding statements. So, Healthy Community Brookfield serves its Dakin community by offering an abundance of programs and services. For programs, they offer employee wellness, after school activities, diabetes education, as well as school and community health wellness programs. And for services, they offer women's health, a mobile medical health service, water quality testing for those in the agricultural field, as well as the government, and vaccination and immunization services. Environmental factors that are surfacing within HCB is this community partnerships. Just making sure that we continue and revitalize those partnerships with other community organizations and to work as a collaborative versus competing for programs and resources. Financial stability has been a challenge that HCB has been struggling with in terms of making sure that we are allocating grant dollars and finances from the board to programs needed for the organization and the community. In terms of community engagement, we just want to make sure that HCB is continuously progressing to meet the needs of the community, whether it's those who work in factories, work on farms, nurses, teachers, school children, just to making sure that we're meeting their health needs and wellness. Internal organization politics refers to the dilemma within HCB where there's a perceived hierarchy among staff members and employees, where nurses and educational and outreach workers are deeming or viewing themselves as lower on the totem pole versus individuals on the executive board. And we just want to ensure that we are not displaying a hierarchy in terms of teamwork. We want to make sure that every individual, regardless of their custodian or the chief financial officer, is needed and is welcome to the HCB community. And the last issue or environmental factor that has been plaguing HCB is the actual accreditation by Public Health Accreditation Board. We did not meet accreditation, and therefore the local Department of Public Health wants to end this contract with HCB. So we are pushing to find ways to negotiate with the department to ensure that we can meet those accreditation requirements. So for situational analysis of HCB, I provided a SWOT analysis. A SWOT stands for strengths, weaknesses, opportunities, and threats. In terms of strengths, HCB does a really great job in terms of making sure there's a diverse group of health professional staff who are devoted to helping the community. There's the abundance of health and wellness programs I have mentioned earlier that HCB has for the community, to strong support from the board of directors to continue to obtain grants and finances for programs, and the cultural connections that HCB has developed within the Dakin community. In terms of weaknesses, HCB struggles with a strong image to community residents. Oftentimes, the feedback from community members is that HCB is still part of the VNA and it's not its own entity. There has been perceived lack of leadership within the organization, and that's just from comments in terms of the nurses, the outreach workers, and those who don't believe that we have a collaboration effort going on in the organization, and the lack of accreditation requirements that HCB has struggled with, which is pushing our community partnership with the local Department of Public Health to possibly an end. In terms of opportunities, HCB can continue to expand its partnerships with community organizations. With that, we should also look for collaborations with those organizations to do cross-program teamwork efforts versus competing. Using research and new technology that we can incorporate into a new program so we stay in a playing field with other major health organizations, not just in the state but in the country. In terms of threats, HCB does struggle with making sure that they're not competing. They're competing for the residents and resources for the same programs. There is a largest threat of the health officials cutting funding and contracts with HCB, as well as potential loss of key staff and associates within HCB due to internal issues. And there's always that economic shift that can happen within the agricultural realm of the city and the community that can impact us as a whole. So HCB's mission and vision is stated on the left. On the right is the shorter versions I have created. On the left, for the mission, HCB states to strive to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. I just took pieces of that mission and incorporated to the one on the right, which states to provide individual focused healthcare with excellence in education, quality, and service. With the vision, HCB's vision states it's to promote healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. I once again just took elements of that vision to incorporate into the one on the right, which is a producer of positive change of health and wellness through community engagement with partnerships to encourage individuals to reach their full potential. So with these, we're once again just want to make sure that we are changing and implementing new ways to incorporate those mission and visions into the services and programs that we have for our residents. In terms of the intervention methods for the 5-year strategic plan, I have proposed 3. The first one will be continuation of improving relationships between organizational departments and members within HCB. If we don't have a strong foundation, we won't be able to strive as an organization to meet the goals of helping the community. In terms of a strategy plan, I have also proposed that we re-engineer the internal mission and vision to meet the needs of the Dayton community, as well as strengthen community partnerships. And then the last strategy would be to implement quality and productivity systems to obtain and maintain public health accreditation for HCB. If we don't have those accreditations, we lose those contracts, we lose the ability to make HCB valid, and which can result in trust issues with the community and try to compete those conflicting ideas. In terms of an action plan for HCB, there's this chart that I've produced just looking at different tactics in terms of to build quality assurance. Those involved such as like the Director of Quality Improvement, the Human Resource Director, with timelines. The goal is to ensure that these items are met, especially with a specific timeline. Some are done quarterly, like the quality assurance, as well, and then like with long-term programs within HCB, we should be conducting that every fiscal year, given that we have to obtain funds and grants and resources for those. And then in terms of increasing community relationships, we need to strategize on possibly doing community engagement interviews or interaction interviews or network analysis, which can help determine what our problem areas are with community partnerships and how we can enhance those if necessary. Evaluation efforts. So only 2 evaluation efforts I can think of at the moment are just for network analysis, which will be helpful in obtaining feedback on community relations and partnerships. those could be done every year or so with community groups such as like the YMCA, United Way, law enforcement, and these interviews are collected and analyzed to see where are we in terms of those interactions, how can we improve our services, how we can work with that organization to improve their services, and just team and collaboration efforts. Then another evaluation effort would be to just hire a financial advisor to examine and evaluate funding and grant management for HCB, because we don't want to allow our funding and our finances to not be allocated accordingly. We don't want to be utilizing so much funding in one program and another program suffering because there hasn't been any audits or any management of those funds. In terms of conclusions, I just believe that we should really revisit the 5-year strategic plan to view how HCB is progressing, along with its changes and organization productivity, as well as quality assurance. Board members should definitely collaborate with the executive team to continue financial support, and encourage accountability for the executive team to ensure that we are meeting our we're meeting our goals, we're meeting our timelines, we are finding ways to meet those requirements for accreditation. And then just lastly, HCB just needs to continue to promote that we are a leading organization serving the residents of Dayton by implementing new programs and changing new programs and offering more services and finding ways to know that to ensure that the community members can come to us for their health services and needs, and to just feel as though we are our own entity, and just allowing for us to make sure we're building those relationships with those key individuals. The last slide is just my references that are used in this presentation. Thank you again for allowing me to speak on behalf of HCB. I'm hoping that with the 5-year strategic plan, we definitely meet our intended goals and we can achieve better health outcomes not just for the residents, but for the organization as a whole.